than 10 months ago, in March 2020, we began caring for the first COVID-19 patient hospitalized at St. Luke's Hospital. None of us could have imagined what the following months would look like.
This virus has just been destroying lives.
It's been a really rough year for everyone, right? For people that have family members in the hospital, for people that have had this virus.
A lot of anxiety, a lot of just wrestling with this beast, really. This has been an unrelenting virus.
I'm really ready to get out of these bad dreams.
I miss hugging my kids and holding them close to me because I'm worried that I could bring something home from work.
It's been a real roller coaster of emotions.
Our team members have found a new strength inside ourselves and learned how resilient and capable we are, especially when we come together.
COVID-19 has been very unfortunate, but it has definitely made our division a lot stronger. We've all been able to come together.
We appreciate each other and our work even more.
I think the staff have been very supportive of each other, so you kind of help lift each other up through the bad times.
On December 21st, the Pfizer COVID-19 vaccine arrived at St. Luke's Hospital.
We have been waiting 9 months for this vaccine to come. I was extremely excited. I was so ready.
A large sigh of relief. There was a lot of anticipation for the vaccine.
It made me feel real proud of my job. I was happy.
I felt very relieved because we can finally feel more safe.
I remember running down to the pharmacy and looking at the ultra cold storage freezer, and I was super excited.
For us, it just kind of felt like a sigh of relief and like a glimmer of hope.
Felt like a breath of fresh air for our coworkers and our patients. This can help us get over this.
For me, the vaccine represented a small light at the end of a very long, dark tunnel paved with separation, suffering, death, questions we didn't have answers to.
It has been a mix of emotion, a lot of excitement, a lot of hope.
I actually was so emotional. I felt like I almost could cry.
You can't help but be a little emotional, realizing that there may be that opportunity, to stop, all, the deaths, the hospitalizations, and to hopefully, ensure that there's more people sitting around the table in homes, as we look towards, another year.
The arrival of the vaccine at St. Luke's was an exciting and humbling moment as we look back on how far we've come since last March. For me, getting the vaccine was a no-brainer. We have the top public health officials in this country, top scientists, and independent regulatory bodies assuring us of the safety of this vaccine, and we have the numbers to support their messages and their communications and their data.
We work with COVID patients every single day, and knowing what this virus can do to a person, I had no doubt in my mind I wanted this vaccine.
I'm a healthcare provider, and I felt obligated. It was my duty.
The vaccination is just kind of the next step towards, getting back to some degree of normality, and hopefully in the future, this will teach us so much.
I feel like it's my responsibility to get the vaccine.
I felt like I needed to do my part in making sure that maybe helping speed along the process to get this pandemic over with.
If we want to help other people, it's important to think about these opportunities. This may be that chance to get back to some sense of normalcy.
Whoever is thinking about it to get it, go get it. We want to get out of this together.
I think that it would be a great thing because then we can eradicate it.
For those that are thinking about getting it, definitely do it. It's only going to help us get back to a normal life.
I would encourage people to think about it and pray about it. I think the positive outweigh the negative. If more people get vaccinated, we're going to stop this virus.
Just think about your loved ones. Think about all the people that have struggled.
If you can keep yourself from getting this COVID-19 or keep yourself from giving it to somebody else who might get really sick, if you can prevent that, do it.
If you decide that it's best for you, you should definitely get it.
I encourage everyone to get the vaccine if it's right for you. I think if we all get it, we can end COVID, and gather with our friends, hug our family members, go out to eat, go shopping, and just be who we were before COVID.
If you do have reservations about getting this vaccine, talk to your healthcare provider. Keep asking those questions. Do what you need to do to get information that will make you feel comfortable so you can make good decisions for yourself to keep yourself healthy and to keep your community safe.